IATA wants governments to get rid of expensive PCR Covid tests. The Oxford Edge Health Report, commissioned by IATA, found that antigen tests are accurate. The best antigen tests provide broadly comparable results to PCR tests in accurately identifying infected travelers. The Binax Now antigen test, for example, misses just one positive case in 1,000 travelers based on an infection rate of 1% among travelers. And it has similarly comparable performance to PCR tests in levels of false negatives. Convenient. Processing times for antigen tests are 100 times faster than for PCR testing. Cost efficient. Antigen tests are, on average, 60% cheaper than PCR tests. Assessment of the effectiveness of rapid testing for SARS-CoV-2 resulted in the following statement. Restarting international aviation will energize the economic recovery from COVID-19. Along with vaccines, testing will play a critical role in giving governments the confidence to reopen their borders to travelers. For governments, the top priority is accuracy. But travelers will also need tests to be convenient and affordable. The Oxford Edge Health Report tells us that the best-in-class antigen tests can tick all these boxes. It's important for governments to consider these findings as they make plans for a restart, said Alexander Dejuniak, IATA's Director General and CEO. Options testing requirements are currently fragmented, which is confusing to travelers. Moreover, many governments do not allow rapid testing. If the only options available for travelers are PCR tests, these come with significant cost disadvantages and inconvenience. And in some parts of the world, PCR testing capacity is limited, with first priority correctly given to clinical use. Travelers need options. Including antigen testing among acceptable tests will certainly give strength to the recovery. And the EU's specification of acceptable antigen tests offers a good baseline for wider international harmonization of acceptable standards. We now need to see governments implement these recommendations. The goal is to have a clear set of testing options that are medically effective, financially accessible, and practically available to all prospective travelers, said Dejuniak. Costs. If rapid tests are not an option for travelers, significant cost and convenience barriers are created. The Oxford Edge Health Report presented the following analysis. The cost of PCR testing can completely alter the economics of travel. A family of 4 traveling from the UK to the Canary Islands will take a total of 16 tests at a total cost of around £1,600 or your €1,850, a premium of 160% on top of the average airfare. A typical London-Frankfurt business trip sees a cost increase of 59% with the PCR test requirement. The modeling shows that based on 5 routes studied: London-New York, London-Frankfurt, UK-Singapore, UK-Pakistan and Manchester-Canary Islands, the cost impact of PCR testing will reduce demand by an average of 65%. Replacing PCR with antigen testing would still have a cost impact on demand, but at 30%. Financial barriers will dampen traveler sentiment, which already displays some weakness. In a February poll of travelers, 58% said that they will travel less for leisure once the pandemic is contained. The same poll saw 62% of business travelers say they would be traveling less. Convenience. In addition to dramatically shorter processing times for antigen testing when compared to PCR, the report also pointed to the scarcity of PCR tests. Current spare PCR testing capacity in the UK, for example, would cover only 25% of 2019 passenger levels. This could cause bottlenecks as and when passenger numbers rebound. Adding antigen testing as an acceptable option would help to alleviate this. When international travel reopens, testing is likely to remain part of the strategy for controlling COVID. The type of testing regime chosen will make the difference in how quickly the travel industry recovers. The choice of a rapid test would be a real boost to the global travel and international business community, and our research shows it can be as effective as other testing regimes and as effective as a 10-day quarantine, said Michelle Granatstein, partner at Oxford and head of its aviation practice. We are already seeing rapid testing becoming commonplace in non-travel settings such as schools and workplaces. Extending its use to travel is a logical step. Science backs this up. In real-world conditions, antigen testing is as effective as PCR testing in reducing the risk of cross-border transmission. Meanwhile, the cost and bureaucracy of PCR tests adds huge burdens to families and businesses looking to travel. These are important considerations in preparing for a successful restart, said Dejuniak.